Hi, everybody. You do not have to call me Dr. Strangelove. It's a movie. But I did like the title because the full title of the movie is Dr. Strangelove, or How I Learned to Stop Worrying and Love the Bomb. And that's kind of how I feel about ringworm, and it's how I hope you guys feel about ringworm at the end of this presentation. When I first started my clinical training, or before I was even in vet school, when I heard about ringworm or thought a cat was going to be a ringworm suspect, I freaked out 100% of the time. I remember one time spraying down my hands with bleach after I thought I had touched a cat who was a ringworm suspect. And I think that's a level of panic that people can get into really easily in shelters and anywhere out in the community. And it is unwarranted because we know what to do with ringworm. It's a pain, it's annoying, but we can manage it. And so I'm hoping that by the end of this presentation, I will have let you all also stop worrying and learn that it's just ringworm. I'm going to try to blow through pretty quickly some of the basics about what is ringworm, our intake protocols and treatment, so that I can focus more towards the end on management and what measures you can take in your shelter, which I think is most of the reason why people are here. So real quick, what is ringworm? As I hope we all know, it is not a worm, it is a fungus. It lives on and in the hair and the skin of cats, dogs, cows, people. Basically any animal can get ringworm. Different species are affected by different species of fungus that cause the ringworm infection, but pretty much everybody can get it. It is usually self-limiting and goes away on its own in a couple of months. It might be a little itchy, it might be a little weird rash, but in general, it's not a big deal. It cures on its own, and I personally have never heard of anyone dying of a ringworm infection. So why do we care so much? We freak out about this pathogen in shelters that I have just told you is a self-limiting infection that does not cause mortality. Well, because it's zoonotic. So if you touch this beautiful little kitten, oh, that was the button I wasn't supposed to touch. Cool. If you touch this beautiful little kitten with this lesion here, you can get this lesion here. And as shelters, part of our mandate is to protect public health. And so it is not acceptable for us to be sending out cats into the community that we know have an infection that can be transferred to people. And again, this is an infection that is more common in the young and the immunosuppressed. And that's true in people, but it's also true in animals. So our target populations for this infection, we really think about kittens and puppies. Primarily kittens. I'm going to be talking about cats as our ringworm poster child in this presentation, although we know that puppies can get it too. That said, when I say animals that are immunosuppressed, we have to think that every animal that comes into a shelter is probably a little bit immunosuppressed. Even if they're totally healthy adult animals, we've taken them from their home, thrown them in a metal cage surrounded by a bunch of animals they don't know. We vaccinated them, which can cause some transient changes in their immune function. And they are now being bombarded by viruses, bacteria, and parasites that they may not have previously seen. So we have to treat all of our shelter populations and all of our patients like they are a little immunosuppressed, even if we have no outward signs that they have any clinical disease. So just as far as the basic mycology of ringworm, ringworm is kind of a collection of clinical signs that can be caused by three major species of fungus. So the number one that we talk about when we talk about ringworm in the shelter is Microsporum canis, because this is the species of ringworm that is by far the most likely to cause outbreaks in our shelter situation. And this is the one that's transmissible between dogs and cats, from cats to each other, and also from cats to people and back. So when we are really talking about ringworm prevention strategies and the fear that we're going to be spreading ringworm throughout our shelter, we're probably mostly talking about Microsporum canis. We can also see infections with Microsporum gypsum, and this strain is also contagious, but for whatever reason, and I can't tell you why, we just don't see it as much in our shelter populations. And then lastly, trichophyton. Animals do come in with trichophyton infections, but at this time we do not think that they can spread it from cat to cat. So interestingly, calves can spread it from calf to calf. They get primarily trichophyton. People are primarily infected with trichophyton. We call that athlete's foot. But in the cat population, we generally see it as a single animal disease that we don't worry about causing an outbreak. What does ringworm look like? It kind of looks like whatever it wants. So we all have this traditional thought of, well, if I see an animal with ringworm, I know it's going to have hair loss. I know it's going to have this crusty red patch. And a lot of times that is what we see. But lesions can range anywhere from very, very subtle, just alopecia, to these giant open oozing sores, which is oddly more common in Yorkies, and I can't tell you why. But as far as kind of general rules, we are traditionally looking for those red, crusty sores with hair loss. So I have here a couple of pictures of cats who do have ringworm. And these are kind of more what we would think about as our classical crusty hair loss cats. But this is a cat that I would look at and think, oh, he has chin acne, and not necessarily go any further with that. This would not ping my ringworm radar, but it is ringworm. That said, what's going on here and here? I don't know who took these pictures saying, hey, I'm going to take a picture of this cat with ringworm and put my hands on it without gloves, but I guarantee you that person did not work for Dr. Berliner. Or if they did, they didn't work for her for very long. So as far as the process that we go through to detect ringworm, it's a multi-step process. So I'm just going to go through those steps really quickly, and hopefully we can kind of synthesize some of them at the end to give you guys a better idea of what you can be doing to protect your shelter from getting ringworm into it in the first place. So the first step that all mammals coming into the shelter should get is a really thorough visual exam. So every single animal, regardless of signalment or history, needs to get a thorough visual exam for signs of ringworm when they come into your shelter. And that, like I said, can range anywhere from like, oh, this cat clearly has a big red crusty patch on his face, to this cat just has a little bit of alopecia. Any of those things can be a sign of ringworm. Any of them can be written up to be looked at by medical staff if your intake folks are not LVTs or DVMs. And when we talk about ringworm, we do tend to see it in some traditional places, which are on the face, inside the ears, corners of the mouth, and armpits, groin, places that the cats really don't want you to be looking, the nooks and crannies, so to speak. And it is easy to have a cat who really doesn't want you looking in its armpits to say like, all right, I'm not going to do that. For this reason, I always call the visual exam a two-person job. I would never try to do an intake on an animal and do their full ringworm screening by myself. Because maybe on a kitten, I can scruff it and dangle it and get it done. But on an adult cat, I find that really, really hard to do myself. And so I think it's okay at this stage in the exam and for the Woods lamp, which we'll talk about in a minute, to say, we need 2 staff on intake for this. I will back you up if you need support with that. And then when we're doing our visual exam, everybody gets one, and everybody gets a really thorough one. But we do also have target populations that we know are more likely to be infested with ringworm, who are going to get maybe a second and a third look. And those are kittens, cats who live primarily outdoors and maybe don't have the opportunity to go back into a house where they can clean up and remove themselves that pathogen load that they picked up from the dirt, or cats that are densely housed. So we're talking about hoarders, catteries, and other situations where cats are in contact with a large number of other cats. Those are most likely to be infected, and maybe those guys get a second look. So this is a cat getting a visual exam. You guys see any lesions on that cat? Yeah, me neither. Okay, step 2, Woods lamp. So every animal that comes into the shelter, in addition to getting a visual exam, gets a Woods exam. It is our best screening test for ringworm that is not visible to the naked eye. And it's super, super cheap. So that's a plus 2. And the reason that we do the Woods lamp exam is because animals that are infected with Microsporum canis glow when they are put under a black light at a certain frequency. And you can see that way lesions that are not detectable to the naked eye. But you have to do the Woods lamp exam right, because a poorly done Woods lamp exam is actually worse than none. Because then you feel like you did it, and you feel like the cat's not lesional, but if you didn't do it right, then that's a false confidence that you have kicking that cat back out into the population. So, some tips for success. Your Woods lamp has to be a real Woods lamp. You can't just go and buy a black light at Spencer Gifts and run it over the cat and feel like you did your job. The Microsporum canis spores actually fluoresce at a certain wavelength, which is 365 nanometers. Woods lamps are designed to hit that wavelength. Anything else, you don't know. So you really need to have a very specific model of lamp. Also, it has to plug in. They do make battery-powered woods lamps. I have used them. They are terrible. They're just not powerful enough. And even if you keep that battery fully stocked, they're still not powerful enough. So don't try, don't struggle. Get one that plugs in. You have to have the lamp be warm. So we always say for the lamp to warm up, you have to have it on for 5 minutes before you're actually ready to use it. In practice, what that has meant at the shelters that I have worked at is it gets turned on at the beginning of the day and it gets turned off when you leave. Because why take that time to be turning it on and off every 5 minutes if you have sporadic intake throughout the day? Just leave it on. The room has to be really, really dark. And that's not because the lamp's not going to work. It's because you need your eyes to work in the dark to pick up these glowing hairs. And if your eyes aren't adjusted to the light, then you can miss hairs that are clearly there glowing in front of your face. You have to go slow. And again, you have to hit those nooks and crannies that the cats don't want you in. For me, I kind of treat my woods exam like I treat a microchip scan. So we've all been taught, you know, when you scan for a microchip, you have to go slow, you have to go serpentine, you have to really take your time. I try to do that with my woods lamp too. Take that extra minute to go maybe back over an area that I wasn't sure of before, just to make sure that I really got it. And the last part is, in order to make sure that you're getting enough powerful light to the cat, I really like to hold the lamp flush to the skin. And in practice, what that means for me is I hold the lamp in my hand, and one part of my hand rests on the cat. And then I tip up the lamp as little as I possibly can to be able to see the hairs underneath. Sometimes that means that I'm doing my intake exam upside down and backwards because I'm trying to sneak under the cat to see the light, and that's okay. Nobody is videotaping me there. They're videotaping me here. I probably should have thought about that before I just did that. But it doesn't matter how stupid I look. It matters how close the lamp gets to the cat to make sure that I can see those glowing hairs. So the reason that I really like this picture, this is the kitten from before. This is a real-life kitten who was really admitted to Dane County Humane Society, who was really woods positive. This cat was woods positive right here on its ear. You can't see anything. There's no alopecia that's detectable there, but this cat had ringworm, and it went into treatment. So now we've got this cat who's positive on this woods exam. But what does a positive woods exam look like? Because it's really easy to be fooled. So a couple things you want to keep in mind. If your woods is truly positive, it is the hair that is glowing, not the skin. The spores that glow are actually embedded in and around the hair itself. So if you look at a cat and you see something glow and it's the skin, that is not a woods positive cat. Also, microsporum does not rub off. It is, again, impregnated into the hair itself and coated onto the hair itself in a way that where it is structurally integral to the part of that hair. So if you have something that glows and you take a wet paper towel and you rub it and it smears or goes away, that's not ringworm. And I know that many, many people in this room have probably been fooled by the color, right? So for ringworm, we talk about it having a very characteristic apple green to what I think is kind of more of a green-blue, but maybe I'm just partially colorblind in that way. And there are lots of things that glow on a woods exam that are not quite the right color, that are not ringworm. For example, everything you put on or into a cat glows, right? Like everything we do in our intake, strongyg glows, doxy glows, if you have cats who are on URI treatment, cat food glows, the powder from your gloves glows, carpet fibers glow, right? Like if you just look at the cat and don't think about it any further, cats look like they're all infested with ringworm, but they're not, because if you take them and rub them down a little bit, all that stuff goes away, and none of it is the right color. That said, if you do your woods lamp exam, you rub it down, it doesn't come off, it's the right green-blue color, and you have made sure that you have not found the single white hair on the black cat, which has fooled people before, right? Because that hair will look like it's glowing. When it's really not glowing, it's just white and the rest of the cat is not. All you need is that one positive hair, and that is good enough for you to start treatment on that cat. You're going to need to do further diagnostics, you're going to need to speciate, you're going to need to track for treatment, but if you have a positive woods that you are sure is a positive woods, you can put that cat in skin ISO and get going. You don't have to wait. So there's this kind of persistent myth out there that the woods exam is not a really great test because not all ringworm glows. And that is true, but it is also false. So there was a textbook out there way back in the day that said that only 50% of Microsporum canis glows under a woods lamp. And trichophyton and Microsporum gypsum don't glow. That second part is true. Trichophyton doesn't glow, Microsporum gypsum doesn't glow. But what we have seen in clinical practice is that the vast majority of Microsporum canis that we see in shelters does glow. Now, is that because the person who is writing the textbook had a different woods lamp technique? Is that because we have a specific strain of Microsporum canis that predominates in our shelters? I don't know. But what I can tell you is that in practice, we see that 90% of our cats who are ringworm positive also have a positive woods. So it is a really good, quick screening test for cats who you think might have ringworm. So if you have a positive woods, like I said before, and consistent lesions, then you're good. You can go ahead and start treatment. You're still going to want to culture those kids and PCR them to confirm your diagnosis. A, because legally, that's probably the best way to cover your butt. And B, because we do need to culture all ringworm positive cats in order to chart their response to treatment. But you can go ahead and get started. Some shelters, and I would encourage you to do this if you're not doing it already, like to further confirm their woods lamps positive by doing a trichogram. And so this is actually a pretty easy test that can really, really solidify your knowledge that you have a positive cat if you have access to a microscope. So all you do is you go over to your cat that has popped woods positive, you pluck that glowing hair off of the cat, and then you look at it under a microscope. And it'll confirm that that hair is in fact infected with ringworm. So I've got a sample here. This is from Dr. Newberry, her picture. And you can see we've got really nice healthy hairs along the margin of the slide here. They're very organized. They have that nice stack of coins appearance in the middle and a really clear cuticle on the outside. And then in the middle here, we have this kind of destroyed, exploded, roughed up looking thing. And that is a ringworm positive hair. The reason it looks exploded is because the spores have penetrated the hair itself and are also coating the outside and have interrupted the normal structure of the hair. And you can see that it actually broke off in the middle here. And we know that hairs that are infected with ringworm are more fragile and more likely to break because the spores are interrupting the normal structure that would normally keep them together. And that'll become important in a minute. So woods lamp positive trichogram, you're not talking about empirical treatment anymore. This isn't empirical. This is confirmation of ringworm. You don't know what species, and again, you still have to culture, but this is ringworm. There's nothing else that this can be. So let's talk about culture for a minute. Culture has traditionally been our gold standard test to confirm ringworm infection. And it is great, and we still really do need to do it on cats that we think are lesional, but it does have some downsides. Number one, it's slow. Fungal cultures take longer to grow than bacterial cultures. And if you're going to call a culture negative, you actually need to give it a couple weeks until you can say there is no growth consistent with ringworm on this plate. I do not think this cat has ringworm. And in a shelter, 2 or 3 weeks is a really long time, and we don't always have it. Culture is easy to misinterpret. So one of the things that they found at Dane County Humane Society when they were culturing every animal on intake is that there are a lot of cats out there who culture positive, who have no lesions, and are never sick. And what we started calling those is dust mop positives. It's really easy for a healthy, normal adult cat to have a couple of ringworm spores hanging out on its skin that it came in contact with in the environment, that it never gets sick. It fights off that infection before it ever starts. That cat poses no threat to the population at large. But if you culture it and you pick up those dust mop spores, then the cat has popped positive on culture, and now you have a cat that you need to treat because you have a positive culture, but the cat's not sick. And so that ends up costing us a lot in terms of culture materials, in terms of time, in terms of treatment for that cat, in terms of the cat's welfare. Maybe that cat is not a cat who does well in a ringworm treatment facility, and now you have condemned it to a ringworm treatment that it doesn't actually need. And so for that reason, we can't recommend culturing every cat who walks into the shelter anymore. It's important to be able to read your ringworm culture plates accurately. So I'll talk about this next in the next slide, but some of them are really easy. Like this is a negative ringworm culture, this is a positive ringworm culture, but they're not all that easy. And like I said, we do have to culture all animals still who are in treatment for ringworm to track response to treatment and to confirm that they are actually cured. So let's talk about detection. I think every place that I have been or talked to uses some variation of DTM agar, which is a special fungal agar that turns red when it is around ringworm colonies. But the tricky part is it also turns red when it's around other fungal colonies. And so you can't just say, like, oh, this turned red, this cat is a ringworm suspect, or this cat has ringworm. You actually have to do more stuff, which I don't like doing more stuff when I can avoid it. But in this case, you do. So there really has to be kind of an in-depth look at not only is the agar red, but what do the colonies look like? So ringworm has these really fluffy, fuzzy, white, never pigmented, always white, mycelial-looking colonies. So if I look at this plate and these colonies, I'm pretty confident that this is actually ringworm. If I look at this plate over here, the agar's all red, but what's this pink thing? What's this yellow thing? Ringworm is never a color. And then this white colony that I have isn't fluffy, it isn't mycelial, it's kind of a rough texture. And so I'm much less suspicious that these guys are ringworm. That said, in order to confirm ringworm, you really do need to do a tape prep of that colony and look at it under a microscope. I'm not going to cover that today, but that is something that LVTs, DVMs, and even trained intake staff can learn how to do. It's not that hard, but that is the only way that you know for sure that a colony on your plate is ringworm. So let's talk a little bit about PCR. This is actually a new test that has been introduced within the last couple of years. It's from IDEXX that can actually identify fungal DNA directly in a sample. And so there are some downsides and some upsides to it, just like any test. It's pretty reliable. There are pretty few false positives, according to IDEXX's data. We actually just had a lecture from Dr. Jacobson where she was using this test at Toronto Humane, where she found the opposite, that there were pretty few false negatives, but a little bit more false positives. So maybe we have to kind of use some judgment as to the difference between what IDEXX is telling us and what we're seeing in our clinical practice. But that said, it is still a really remarkably accurate test. And more importantly, it's fast. It only takes a couple of days to get this result back. So it is a little bit more expensive, but you also have to weigh, okay, I'm paying a little bit more for the test, but if I don't have to hold this cat in isolation and spend the time and money on extra isolation procedures, am I making that money back by speeding up my time to 3 days instead of 2 weeks? It can speciate the strain of disease for you. So IDEXX can send you back, they'll send you a little note that says yes positive. I can't tell you how much, but it can tell you yes positive, Microsporum canis. And that can have ramifications for your population management, since we know that Microsporum canis can cause outbreaks, but trichophyton, for example, generally doesn't. So it may have meanings for where you put that cat if you're using ringworm foster, that kind of a thing. The PCR, just like the culture, cannot distinguish between a dust mop cat and a clinical cat. And it cannot, although I just found out they can if you call them, it doesn't really tell you the difference. All it tells you is positive or negative. It doesn't say, whoa, super positive versus a tiny bit positive. So those are things that we have to either use a culture or our lesions on our cat to really quantify for ourselves. So I just gave you a bunch of tests. They all have different uses. When do we use what? Number one, Wood's lamp and your eyes. Used for every animal, every mammal that comes into the shelter, regardless of whether you immediately suspect they have ringworm or not. Trichogram is a good diagnostic for when you have an animal of whom you are suspicious of having ringworm. Not a good test for animals that just look totally normal and have a totally normal Wood's lamp, because you're going to be pulling hairs off that cat all day looking for the one that has ringworm. You will not find it. Cats have more hairs than you do patients. PCR is really good for confirming infection quickly in a cat that you already have clinical suspicions for. And culture is the best to track response to treatment and cure in cats that we have confirmed are infected in some other way. We do not recommend using it to confirm infection anymore. We have better ways to do that. Okay? All right, so let's talk a little bit about how ringworm causes our problems, how it is transmitted from cat to cat or from cat to person. So transmission of ringworm actually requires a couple of steps that all happen the right way in the right time in order to cause an infection, just like any other infectious agent in the world. Transmission requires viable spores that can grow, that stick to a break in the skin. Totally intact skin is an excellent barrier against ringworm, as it's an excellent barrier against almost everything else. So you need to have skin trauma in order for ringworm to get into it and seed an infection. If you can reduce or eliminate any of these factors, you can reduce or eliminate your chances that cats are going to get infected. And luckily, cats are really good at doing our work for us if we know how to help them. So let's start off with viable spores. I have a couple of things in this presentation that are bright red, and those are the things that I want to yell, but I can't yell because I have a microphone. So the things that I want you to know: it is difficult to get ringworm from environmental contamination. The primary route that people or animals get ringworm from is for direct animal-to-animal contact. You touch the cat touches you, the cat touches the other cat. It is much, much harder to get ringworm because you touched a doorknob or touched a mat of hair, okay? It is so difficult to prove that that happens that actually the reason I have this burner up here is because there is a case study written up from a kid who got ringworm from a used car that his parents had bought. He got ringworm, nobody could figure out why. Turns out the people who had owned the car before them had a dog who had ringworm. There was dog hair in the back seat. The kid got ringworm. Okay, that's clearly that kid got ringworm from that car, but they also wrote it up in a medical journal, and if they had to write that up every time that happened, you would know that it must be rare enough to be remarkable, right? So primarily we're talking about direct animal-to-animal contact. So we're about to have this whole conversation about cleaning and management of ringworm. Why am I doing that if I'm telling you that all you have to do is not touch the cat? A couple reasons. Number one, when we clean, we reduce our dust mop positives in our shelter and in our infected cats. And what does that do? That means that you're less likely to culture a cat that is cured in your ringworm unit and get ringworm back from it because of environmental contamination on your toothbrush rather than what was actually on the cat. It also means that you're less likely to take random samples from your shelter because you want to be sure that you're doing the right thing, get ringworm back on them, and then have to freak out. We also need to protect the vulnerable. You know, we are shelters. We have all sorts of people coming in and out all the time. Little kids, volunteers, many of whom are elderly, many of whom may have health conditions that you don't know about. We work in veterinary medicine. We're almost all women. Sorry, guys. You don't know who's pregnant. The person who's pregnant may not know who's pregnant. We have to protect those people. And because they are slightly immunocompromised, they are more likely to get ringworm from this route that we are saying is not common in normal, healthy, immunocompetent people. So what does that mean for us? The most important thing you can do to keep yourself from getting ringworm and to keep your cats from getting ringworm from you is to wear gloves. Wear gloves. I know we've had a couple of conversations here, you know, Dr. Rodriguez talked, Dr. Putnam talked, we all talked about, yeah, but I hate wearing gloves. I also hate wearing gloves. Ringworm suspects are one of those where you can't compromise and you can't play. Wear gloves. We also have to think about what does this mean for our open floor plan shelters. So these are shelters where maybe you do have a bunch of animals who are all kind of hanging out in one area, who are coming into a lot of direct animal-to-animal contact. They're at special risk. And maybe you know that you have to be really stringent on your intake procedures if you're in an open floor plan shelter, because once you put that animal into general population, if there's a lesion that you miss, or if they were not lesional yet when they came to you, but they become lesional after, you have to know that you are now in a situation where you have to kind of assume that because of the direct animal-to-animal contact, the rest of your population is at much more risk than they would have been if you didn't have that floor plan. Communal housing, again, this is another thing where maybe you don't have a true open floor plan shelter, but you have areas where, you know, adoptable cats go into communal housing. This is one where maybe if you have a cat that you're thinking about putting into communal housing where they've been in your shelter for a couple weeks, maybe you woods them again just to make sure they didn't pop a lesion while you weren't looking, because you know that if you put that cat into communal housing and it gets ringworm, then now all those cats need to be treated like they have ringworm. And last, mixing kittens. I'm a person who adopted an orphan singleton kitten. I am very much in favor of mixing orphan singleton kittens because you can look at the scars on my arms to see why. So I understand that they have great social benefits, mixing kittens. But if you're going to do that, you have to understand that you are putting all of those kittens at a slightly higher risk for contracting ringworm. And you have to have a plan for that. So if you are able to say, OK, I have these 4 kittens, I'm going to mix them all together. And if they get ringworm, I have the capacity and the staff to treat all 4 of them for ringworm, then that can be a risk that you choose to take. But you have to think about that first, because if you mix all those 4 kittens and then they all come back with ringworm and you don't have a place to put them, you screwed up. I'm sorry. So let's talk about spores adhering to skin. Normal, healthy cats are actually really, really good at preventing themselves from getting ringworm. They groom obsessively, and they groom off the spores and swallow them and put them where they can do no harm to anybody. And so we know that higher stress in cats and shelters depresses normal behaviors like grooming. And so we know by association that if we can reduce the stress in our cats, they will increase their rate of grooming, which will reduce the likelihood that they do get infected from any residual environmental contamination in our immunosuppressed population that we know exists that we might have missed. Side effects will also reduce your URI rates because we know that stressing cats is a really important part of any disease that we have in the shelter. So this is just another reason to stack on top of that list why we need to work on low stress housing and low stress management in cats. And then just as a side note, because long-haired cats do struggle with grooming, super obese cats do struggle with grooming. I think we've all seen, the guy who can't get to his butt, or the really long-haired one who gets its tongue all the way out as far as its neck can reach and then can't get to the end of the hair. Those guys can't groom as well. They are at a slightly higher risk of contracting ringworm because they can't take care of themselves. Again, kittens, we talked about being more prone to infection. A couple reasons for that. Number one, kittens don't have the normal healthy immune systems that adult cats can use to resist infection, but also kittens are disgusting. Children are disgusting, right? They don't clean themselves. They don't know how. No one has taught them that yet. And so any spores that they are exposed to just kind of sit there and hang out and have the time to establish an infection that an adult cat would not give them. So let's talk about breaks in the skin. So I know that historically people have been recommending or have been prone to clipping cats to see whether they have ringworm or not, to confirm that a lesion actually exists. We don't recommend that anymore. Why? Because clipping actually causes trauma to the skin. Even if you're not seeing razor burn, there is subclinical microtrauma that happens after you clip a cat, where if you had ringworm in that cat, or if you have some in your environment, you have now just set up a perfect bed for it to reproduce. And then also we saw that hair on the trichoglam slide that was kind of exploded and shattered and went everywhere. If that cat does have ringworm, you've now just run a clipper over these really fragile hairs and dispersed them, who knows where. And so that is a really good way to increase your environmental contamination, or maybe spew little hair parts at somebody where they're coming in direct contact with it where they wouldn't have done before. Some exceptions to that. If the cat is so matted that it can't groom itself, it can't perform those normal behaviors that we ask cats to do to prevent ringworm infection, you can clip it. Or if the fur is persistently wet, maybe it, as a cat who can't get to its butt and it's got a lot of urine scald, that also causes microtrauma. And so you kind of have to weigh your risks and benefits in those situations. And in those cases, they're going to be having microtrauma if you don't clip them, and they're going to be having it if you are. So just go ahead and clip them and relieve the cat's discomfort. Another thing to think about is that external parasites cause microtrauma. Fleas, ticks. And we'll talk about that more in a second. This is my token treatment slide, because this is not what this presentation is about. But just so you guys know, we do recommend both topical and oral treatment for ringworm. What topical treatment? Lime sulfur, lime sulfur, lime sulfur, right? There are studies out there using other different kinds of shampoos with different kinds of antifungals in them, but lime sulfur is dirt cheap. It lasts a really long time. You can get away with dipping a cat just twice a week, whereas some of the other compounds you need to do every day. And it's super effective. And for those cats who are pruritic, we don't think that all cats who have ringworm are itchy, but If they are, it actually causes local anesthesia at the site of the lesion. So they feel better right away after you dip them. And they look like that. But that's okay. As far as orals, there's been a bit of a shift in this recently. Traditionally, we used itraconazole, which still works great, but lately it's become really, really expensive. And so there are studies out there talking about terbinafine to be used instead, and we have seen that it is actually really effective as well. Some places still do use fluconazole. We don't think it penetrates the skin as well, but it's better than nothing. And then as far as cats, ketoconazole is not a good idea. It is toxic in cats. Griseofulvin is not a good idea. It's toxic in cats. So these three are really our three options. Of them, I would recommend the top two. But again, this is something where, developing your ringworm treatment protocol, you're going to be working with a vet. That's why I didn't want to, get too deep into doses or anything, because that isn't what this presentation is about. I want to take a quick sideline into welfare considerations for cats. So when we talk about putting cats into treatment for ringworm, we have to know going in that this is a long stay condition. So if you talk about monitoring a cat with culture until clinical cure, in order for them to be mycologically cured, we say that they need 2 negative cultures at least a week and preferably 2 weeks apart. So then we talk about each of those cultures takes 2 or 3 weeks to grow out so that you know that the cat is negative. Well, that's what, 5 or 6 weeks we're talking about leaving a cat in treatment just to confirm that it's negative, not even talking about how long it takes as far as dippings and treatments for you to get to the point where the cat is culture negative. So this is a condition of weeks and weeks in the shelter. And our patients, by and large, are little kittens. And so we have to think about their welfare whenever we're deciding whether or not to treat this animal. It is really, really easy to forget that your ringworm kittens exist, because usually they are hidden off in a corner somewhere that people try not to go because it's got ringworm in it, right? You don't want a lot of excess traffic through there. And so it's easy to forget to socialize the ringworm kittens, and then you have a bunch of kittens in a back room whose only experience with people is that they dip them twice a week, and that's not super fun. And so we have to think about how can we optimize these kittens' care so that their housing is humane and that they become adoptable cats on the other end. And so one of the things that I saw at Dane County that they use at FIT is that they actually have a dedicated volunteer force that just does ringworm. In the winter, obviously, they can be put to use doing other things. But those people who are our FIT volunteers just do the ringworm kittens, and they're perfectly happy to do that. And so I think if you have people who are amenable to that in your shelter, it's a really good option, because that way you can use them for a couple hours. They can do the cleaning, they can do the dipping, they can do the socialization, and those kittens get the time that your other kittens would get from the regular volunteer staff. We'll take a quick side note into volunteer recruiting. If you were at Dr. Berliner and Dr. Jacobson's talk last hour, you've already seen this picture. This is a picture from Humane Society of Silicon Valley, which is a shelter that had a really bad ringworm problem. So Silicon Valley is obviously a very upscale and affluent area, but for some reason they had this weird outbreak of ringworm kittens last year, and so they put out this push to try to recruit volunteers to actually do ringworm foster. And you think, okay, I'm asking these people to take these cats with an infectious disease into their house, and it's going to be lime sulfur and it's going to smell bad. Who would want to do that? And the truth is, the right campaign can make a difference. People want to feel important. People want to feel needed. When it comes to kittens, people want to feel like they're saving lives, right? And if your shelter can make them feel that, can make them understand the difference that they are making in the lives of these little kittens who might otherwise get euthanized, then I think you will see that people do sign up for things that you would not expect them to. That said, when you're selecting these volunteers, the right volunteers can save a lot of lives, and the wrong volunteers can make you want to burn the building down, right? Because we do know that ringworm is a zoonotic disease. And so if we have people who are volunteering with our ringworm kittens who don't understand that, or who have a history maybe of getting a little fast and loose on your sanitation rules, maybe those aren't the right people to be working with your ringworm population. And I think that if you are going to use volunteers in this way, you do need to have the capacity and the willingness to kind of screen your volunteers on something other than interest. It needs to be on capacity and understanding. For some reason, everywhere I go, I have found that retired nurses are excellent excellent shelter volunteers because they really understand infectious disease and they understand sanitation. And so if you can use them in this context, then that's really great. That said, you do have to think about the volunteers' medical status. We can't ask a person if they're immunocompromised. That's immoral and probably also illegal. But what you can say is these kittens have ringworm. Ringworm is a zoonotic disease. It's usually self-limiting, but can be more serious in people with underlying medical conditions, and then give the volunteers the option to opt out without any more explanation or without any guilt, because that's the best way to protect them and also to protect us. So ringworm foster homes, I know I mentioned it earlier, and I think there's a big movement around this where people are thinking about using foster for ringworm, where we hadn't before just because we were too afraid of the risks. And this is another one where if you have the right people who understand in the right way, I think ringworm foster can be awesome. If you have people that you're sending ringworm kittens out to and they don't understand, or they maybe let the kittens out of the bathroom, then you can make yourself a real problem for that kitten and for all the kittens that come after that kitten that didn't have ringworm when they went into the foster home, but do now. And so I think this is a viable option if the people in your community are ready for it. And so I think there's going to be a lot of shelter-specific selection on what does your community look like, what kind of training do you have the staff to do with these people, and from there, kind of judge your success and see on a house-by-house basis if ringworm foster is working. And then we got to talk about welfare considerations too, because like I said, ringworm is a long stay condition, and not everybody who comes into your shelter is up for a long stay. So ringworm, I think, needs to be considered as a complicating medical factor, just like any other serious or infectious health problem would be a complicating medical factor for an animal coming into the shelter. So maybe a really nice kitten who has ringworm is not a big deal. You can put that kid through treatment. But maybe a geriatric 16-year-old cat with kind of iffy kidneys doesn't have the same prognosis to go through ringworm treatment as that kitten did. And I was actually chatting about this presentation with Dr. Jan Scarlett, who is one of our pioneers of shelter medicine here at Cornell, and she had a story for me about a sanctuary where she had done a consult because they had a big ringworm outbreak, and they did choose to go ahead and treat every cat. It was a sanctuary. It was really important to them that everybody go through treatment, and they did see a break of mortality after ringworm treatment in some of their cats just because it was hard and they were old and they weren't ready for the stress of being dipped a couple of times a week. And so we really have to think about, as the medical staff in the situation, not just what we can do, but what we should do. What is best for the cat? Is it best to take this feral cat and stick it in a ringworm treatment facility for 8 weeks and dip it twice a week? Maybe not. But maybe for the healthy, friendly, affectionate 4-year-old, it is the best choice. Okay, so let's talk about management of ringworm in your shelter. I think we all kind of have this perfect world idea of what a ringworm treatment area should look like. Maybe it should be a dedicated facility like that FIT building from Dane County Humane Society that I'm so familiar with a separate entrance and exit, so true isolation. Should have a separate air system so you're not blowing ringworm from the ISO area back to the rest of your shelter. Volunteers that only work there, maybe PPE that only is dedicated to that, laundry machines that only is dedicated to that, and all that stuff is amazing if you can get it. I only know one place in the world that you can get it, and that is where I came from, Dane County. And in a lot of places, our ringworm treatment area looks a lot more like this, which is our ringworm treatment facility at Tompkins County. This is a single room on a hallway directly across from the office where I eat. It does not have a dedicated entrance and exit. It does not have a dedicated air facility. And I can tell you that there's nothing in there right now except this garbage can and a couple of shelves because our cage banks are being repaired because we have nuked them with bleach. So this is not an ideal world, but this is our ringworm isolation area, and we treat kittens in here, and you can do that. So what really matters in the actual world? You do need to have a room to be your ringworm or skin isolation room, and it needs to be a different room from your URI ISO, because if you put them in the same room, then you just have a bunch of URI kittens with ringworm, which is not my idea of fun. So you have to have a room, but the airflow doesn't actually matter. So Dr. Moriello, who is the dermatologist at UW-Madison, who's been doing research on ringworm in shelters for longer probably than I've been alive, did a study back in the day where she was taking samples from different places in their ringworm treatment center to see where the airflow went and if the airflow from the ringworm center was contaminating other areas in the shelter. And what she found in her study was that reliably the air from the ringworm treatment area, the spores did not go anywhere else. Where did the spores go? They went into the filter, the HVAC filter, and they stuck there, which is awesome because that's what an HVAC filter is supposed to do, right? So the best way that you can protect yourself is to use a high quality HVAC filter in your air system and to change it routinely. And if you can do those things, you do not have to worry about ringworm running through the ducts. We talked a couple of times about ringworm being a long stay condition, and you do need to make sure that you have humane cage space to keep cats for weeks, okay? This is not the place to skimp and use the crappy cages that, you don't worry about as much because they don't get used as much. If you have some crappy cages that you want to use in your ringworm ISO, at least put portals in them because we need to be able to have these cats in this space for weeks and weeks and weeks without preferably them breaking with URI or going insane. You do need to have something to do treatments in. So as far as dipping for ringworm, we'll talk about that real briefly now. So this is a picture of a cat being dipped at fit, and there's a bucket. That does not mean you put the cat in the bucket. Please don't put the cat in the bucket. Please don't put the cat in a sink full of lime sulfur. You don't need to do that. Actually, what they do is they take this garden sprayer and they fill it with their lime sulfur solution and they just spray the cat down. And then they use a wet washcloth with lime sulfur to go over, the eyes and ears and the places that you don't want to spray the cat full in the face. That's it. That's perfect. It's way, way less stressful for the cat too, because all the cat really has to consent to is being held. You're not trying to dip it in a bucket of water, which no cat I have ever met likes. And they have been doing this for decades with treatment and cure rates as good as anywhere you go. So invest in a couple of these garden sprayers, and it also ensures that you don't need a sink in your ringworm URI area, right? As long as you can take this bucket and have the sprayer, and ideally you would have somewhere to dump the bucket of disgusting lime sulfur dip out in your ringworm treatment area, but if you don't, you can make it work as long as you have a nice clear path from this bucket in the ringworm ISO area to the outside or to a sink. And that really can free up a lot of spaces in your shelter that maybe don't have sinks, they just don't have faucets. You need to make sure that you have storage space in your ringworm ISO for everything that you need, because the last thing you want is for somebody to get all gowned and gloved up and then realize that they forgot the whatever and then go out in their gown and glove and dirty ringworm outfit to go get the whatever. Right. So you have to make sure that you have adequate shelves or buckets or tubs or whatever that you can put in everything that you need and that you keep those stocked. And then this is an area that you're going to want to clean last. Again, if you can use those volunteers to do your dipping and your socializing and your cleaning, and that's all they do, that's awesome. Then you don't have to clean it last because those volunteers aren't going to go anywhere else in your shelter and contaminate it. But if you don't have the ability to do that, clean last. The other thing we want to think about is minimizing environmental contamination for the rest of the shelter. So some of that is what I just said. Have dedicated cleaning equipment in your ringworm ISO area and have it fully stocked so that people don't have to tromp in and out. But there are a couple of other easy things that we can think about. So you saw in our picture here at Tompkins County that we have kind of this hallway coming in, right? And then the area opens up and this is where the cages would be. So my kind of half viable thought is, what if we could take a door, like a storm door, and install it here to make this area like a little vestibule. And that's where you store your clothes, you put on your Tyvek suits or your dedicated ringworm scrubs or whatever, you store your shoes, and then that way it makes it really easy for people to change everything that we're asking them to change and go in and out without cross-contaminating themselves because they have a dedicated area for that. We want to make it easy to use PPE. So in these areas, we're going to emphasize, you need to wear, if you have a Tyvek suit, a Tyvek suit. If you don't have a Tyvek suit, at the minimum, a separate set of scrubs or a lab coat that is only used there. Separate shoes. At Dane County, they have Crocs that are only used in the ringworm treatment area. I like that. I think it's a really inexpensive way to make sure that people do the right thing in regards to their footwear. But we're going to be asking people to do all those things. And in order to make sure that it's going to happen, we have to make it easy. So one of the things that I have been thinking about, now that I'm the doctor now, is those days when you walk through your shelter and you notice this box of gloves is empty, this roll of paper towels is empty, the soap is gone over here. And that's the kind of stuff, it happens in a shelter. We go through a lot of soap, we go through a lot of paper towels, we go through a lot of gloves. And those things empty out. And it's really easy to just say, oh, there's no gloves, and then go on to doing whatever you're supposed to be doing with gloves without gloves, right? I do that all the time. But now that I'm the doctor, I have to kind of take it on myself to be the person who stops and refills the gloves. Because if I don't make it easy for people to do the right thing, then the right thing isn't necessarily going to get done. And in the end, that's not on them, that's on me, because I'm the doctor, right? And so I would challenge you guys, when you go back to your shelter, maybe it's you, maybe it's somebody else who's designated on staff, try to find somebody who doesn't mind being that person. The person who's going to always make sure that the towels get refilled when they run out, that the soap gets refilled when it runs out, because it has to be somebody, because otherwise it's not going to get done. And if it doesn't get done, then that's when mistakes happen. And it's our responsibility, really, as the medical staff, to not let those things happen. So make it easy. Skipping down, we talk a lot about cleaning, and in the shelter at large, I think we do a lot of sweeping because there's a lot of mechanical debris that we have to sweep up. In the ringworm area, that's not necessarily a good idea, right? Because what we're doing when we sweep is we take all of that hair and dust and stuff that we know has ringworm spores in it, and we sweep it up into the air. Because no matter how well you're sweeping, some of that cloud of dust does get stirred up. And so what we've found at Dane County is that Swiffers actually work really, really well in this context because they are still taking care of all the hair and the dirt and dust and stuff, but instead of puffing it up into a pile, they actually trap it so that you can throw it out. And so this is true for sweeping, but it's also true for mopping. So they actually make mop heads that work on similar principles as Swiffers that can lock in dirt and then get washed to be reused. So if you can replace your traditional floppy mop with one of the electrostatic or dust washable mops, I think that's a really good and easy way to minimize the amount of ringworm hairs that we're flowing around in the environment. We want to limit our movement of materials in and out. And then when we talk about laundry, traditionally, I've always been told to throw out the ringworm laundry. And that's totally fine. If you have enough towels to be throwing out the ringworm towels, there is absolutely nothing wrong with that. If you don't have enough towels to throw out the ringworm towels, you can wash them. We've done studies on this recently. So even cold water with no bleach gets off most of the ringworm spores. Hot water is optimal, but bleach doesn't make a difference. So when you're doing your ringworm laundry, there are just a couple of key things that you want to keep in mind. Hot water if you can. If you can't, cold water twice. Gets rid of all the spores. You can't overfill the washer because once you overfill the washer, right, the water doesn't flow and it's not penetrating all of the materials that you're putting into the washer to get the spores out. And then when you dry it, again, don't overfill the dryer. And you have to actually dry it until it's dry and not do the thing that happens, I think, at most shelters where like, oh, they're kind of dry and it binged, so I'm done. It has to be dry, like actually dry. And then when you're done with the ringworm laundry, which you should be doing at the end of the day, like you would do any of your infectious disease laundry, clean the lint trap. Because if there are any spores left in the dryer, they're going to get caught in the lint trap. But if you clean that out and throw it away, you have thrown away those spores as effectively as you would any other time. So let's talk about procedures for cleaning and handling. And I want to emphasize here that we talked a little bit about layout and kind of facility structure in your building, but more important than that is how you clean and handle ringworm patients and also the materials that come off them. And again, I'm going to emphasize the most important thing we can do to prevent our volunteers and our staff and then thus the rest of our animals from getting ringworm is personal protective equipment, gloves, and then dedicated scrubs. I really like lab coats actually for a couple reasons. One, my scrubs end here, my gloves start here. There's a lot in between there that isn't protected from ringworm, right? And then also, I am the kind of person who, when I am doing something with a kitten, I can't not put it on my hip right here. And I think that is true for a lot of us. Lab coats are really, you don't have to take your shirt off to change your lab coat, right? You can just unbutton it and then throw it away. So I find lab coats to be a lot easier and more manageable when I'm handling ringworm patients than scrubs. But whatever you have is fine. Parasite control, we talked about that briefly before. What we've actually found is that fleas and lice coming off of cats who are ringworm positive can themselves carry ringworm and culture ringworm positive. So if you have an animal that you have as a ringworm suspect, and I like, honestly, for everybody coming into the shelter, they should be capstarred and quarantined until the capstar has worked. That doesn't need to be a complicated quarantine. It can just be they stay in your intake facility and don't go anywhere else. But you should consider that all of those fleas are little ringworm carriers that can hop anywhere else onto any other cat in your facility and give it ringworm by not only having the spores on it, but creating microtrauma that the infection can seed into. And then think about other parasites. Ticks can obviously also culture positive and bite, but they tend not to get down and run around, so I'm a little bit less worried about them. Consolidate and box whatever you can. So we're going to talk about, for ringworm, mechanical removal of debris being the most important step in cleaning, which is really, really easy if you already have a Rubbermaid tub or Tupperware where everything lives. This is our intake room. If we get ringworm in here, I want to be sick that day. I have no interest in trying to clean this and get all the hairs out of it. So if you can make your intake room look a little more organized than ours, have stuff in cabinets where it belongs in cabinets. If you don't have cabinets, use tubs. That way when somebody gets missed and you do have ringworm hair in your intake room or in wherever, you don't have to spend the entire day throwing out individual packages of Revolution because they all have hair on them. And then we'll talk about cleaning really, really briefly. So it's a common myth that ringworm, once the spores drop off the cat, gets into your carpet and multiplies. It's not true. Ringworm needs hair and skin to grow. And so Dr. Moriello at Wisconsin always talks about ringworm. It's not seeds. It can't drop off the cat and germinate and then make 1,000 new ringworm spores. They are M&Ms. So once you've cleaned up all the M&Ms, you're not going to have a magical M&M tree sprout and make more. So all you have to do is stay ahead of the spores that are coming off the cat and into the environment. And you don't have to worry about it setting up an infection in your environment. We talked a little bit about cleaning in Dr. Rodriguez's talk, so I'm not going to belabor it, but we've got 3 steps in cleaning, any kind of cleaning. Number 1 is mechanical removal of debris. So for ringworm, we're talking about hair and dander. Then we talk about cleaning anything that's left with a detergent and disinfecting. And this is something that Dr. Moriello has really started to emphasize that I think is a big change to how we think about ringworm. Mechanical removal of hair is more important than the disinfectant that you use. I'm going to say that again. Mechanical removal of hair is more important than what disinfectant you use. Vacuuming, sweeping, mopping, picking up dust bunnies. Whatever you can do, get the hair and the skin out of the environment. That is more important than your disinfectant. But we will talk about disinfectants because that's why I'm here. Historically, when we talk about disinfecting after ringworm, we use high concentrations of bleach. And that works, but it's corrosive and it's irritating, and it needs to be remade pretty frequently, and it's easy to do wrong. And what we're beginning to find is that actually many disinfectants are effective against ringworm. Bleach and Excel have kind of become the standards for what we use, but technically anything that has a label claim against trichophyton can work against ringworm. So this is going to be an evolving area. We're going to have, I think, new cleaners come out in the next 5 or 10 years where we didn't think that they worked against ringworm before, and we're changing our minds. But again, when in doubt, clean. 1 sec, I'm almost done. So just to sum up, ringworm, even though we may all panic about it, it doesn't have to be a death sentence. You can manage ringworm no matter what kind of a shelter you have and what your facilities look like. Doing a proper screening intake can save you a lot of work down the line. We want to make it easy to do the right thing. Cleaning and disinfection, make it easy, and it'll happen more. And when in doubt, wear gloves. So I have just a couple of thank yous to Dr. Moriello, Dr. Newberry, and everybody at UW who taught me everything I know about ringworm, and also the staff techs and vets of Dane County Humane Society, Tompkins County ASPCA, and Dr. Berliner, who gave me my job, which I appreciate, and Maddie's Fund for funding the conference.